Dermatillomania. Until I found this Wikipedia article, I had never heard of it being called excoriation disorder. That might be an American term. I'm going to refer to it as dermatillomania because that's what I've always known it to be. So yeah, we've clearly got Wikipedia here. Let's get a quick definition. Dermatillomania is an obsessive-compulsive spectrum mental disorder that is characterized by the repeated urge or impulse to pick at one's own skin to the extent that either psychological or physical damage is caused. It does specifically say pick there, but for me it's scratching. A little bit further down here. Yeah, compulsive urge to pick, squeeze or scratch at a certain surface or region of the body. Yeah, so this is a bit of a weird one. I'm going to start right from the beginning because some of it, I don't know how much of my history with this is actually dermatillomania or whether it's OCD. But actually dermatillomania is classified as an OCD related disorder. So it kind of might be both of these things. You might have heard of trichotillomania, which I think is more common than dermatillomania. Trichotillomania is when you have a compulsion to pull your hair out. Sometimes it's in certain patches or sometimes it's just all over your body. I've had a mild experience with this as well, but nowhere near what my dermatillomania is. So, as a baby, I had eczema pretty much all over my body. Hair fell out a couple of times up until I was about 2 years old. And then when I was 6, it just sort of magically disappeared. Like I never even had it. That was odd. But apparently also normal that you can just kind of like grow out of certain skin conditions, and eczema. But I remember it being really itchy, as most skin conditions are. And I did scratch a lot as a kid. Had special bath ointments and things and skin creams and lotions and things. But yeah, it was very itchy and I scratched a lot. And even after 6, when it just totally disappeared, I was still scratching a lot. Now, I don't know how much of that at that point was almost like a learned behavior, just like a habit that had formed, because if you've been doing it for years and years, and I suppose as a kid you don't have quite as much like conscious self-control over what you're doing. Well, it's questionable, I guess, but yeah, it almost remained as just like a habit, and it was mostly on my legs, mostly down the backs of my legs, mostly down the backs of my calves, a lot on my arms, my inner arms, like inside my elbow, a lot around my ankles and my feet. I've actually got quite bad scars on those areas now. Like the skin's just much darker and like tougher, especially on the backs of my legs and around my ankles. Yeah, so it kind of carried on, I think, maybe just as a bit of a habit. It's hard to say. And then there was a weird phase at school where I started scratching my skin because, okay, look, at 7 years old, you're not going to know much different. Like, I didn't know any better. But I think it's going to be along the lines of somebody would have said something to me. I went to an all-white school. I was the only brown kid there. And I think somebody said something to me along the lines of a suggestion that I was covered in something or coated in something, or the idea that underneath my brown skin, I was white. So I went through a phase of repeatedly scratching my skin, not out of habit anymore, but because I was trying to take my brown skin off. As in like if you scratch your skin enough, like it just starts to go like white and pale, because you're just taking the surface of your skin off. Like it's just loose, dead skin that's then covering your skin that then makes your skin look lighter. Obviously, you're not going to understand that when you're 7. And I had no explanation for why I was brown. Like I didn't know why I was brown. I didn't understand. So some other kid saying to me that like I was just this way because I was covered in something. I just tried to scratch it all off. So that went on for some years. And then eventually, like when I realised that skin wasn't going anywhere, it became associated with the bullying. So it became associated with the racism. So then it became the coping mechanism of how I dealt with being bullied. It was just automatically to scratch and scratch and scratch and scratch. And it was almost like an anxiety relief. Just because at that point I'd just been doing it years and years and years. And again, just some sort of learned association of it. And yeah, there's no surprise that by the time I was 13, that had sort of manifested itself into cutting. And I was cutting my arms and burning my legs and other things. That's a very different video. So this kind of morphed itself from being potentially a skin condition into a habit, into some weird misplaced ideology that I had white skin underneath my brown skin, and then anxiety related to the bullying, and then it became self-harm. And then eventually, I was just old enough to have an awareness of this sequence of events. But it's still there. And that's the problem. That's the part now that makes it OCD related, because it's a compulsion. Like I have absolutely no control of it whatsoever. I think even from probably 11ish, I already had absolute no control over it. To the point that I do it in my sleep. How are you supposed to control that? Like I'll wake up with blood under my nails and massive scratches down my legs, and there'll be blood on the sheets, and this is decades later. There's not too many ways of controlling this. You can try wearing gloves in your sleep, but for me it doesn't work. Like I will automatically take those gloves straight off. They'll be on the floor by the morning. One thing that does work for me, or at least helps, is coconut oil, or any kind of oil really, olive oil if you want to smell like a salad. It won't stop you scratching, but it will go some way to mitigating the damage that you're doing to yourself. So it's much harder to damage your skin if you're covered in coconut oil, because you can't get the grip. There's no scratch. There's less friction. So that's a good idea if you find you are actually damaging yourself, which is likely with this. So yeah, coconut oil on a daily basis, mostly around ankles, feet, inner elbows, backs of my knees. Yeah, it's not fun. My brief encounter with Trichotillomania, that kind of stopped. It was never that bad anyway. It really wasn't. I've known people that have had far, far worse experiences with trichotillomania. But I used to pull my eyebrows out and my eyelashes. Again, it's completely compulsive. So again, sometimes in my sleep, and I would wake up with massive patches of my eyelashes just missing. Or be sat in front of the TV and just pulling my eyebrows out and just have no awareness of it at all. None. Until I'm like, wow, there's a massive patch of eyebrows now on my lap. It's compulsive. It's compulsive. But at some point that stopped, thankfully. As far as I'm aware, haven't had any issues with trichotillomania in quite some time, at least about 5 years, I think. Maybe 5-6 years. Yeah, it's very strange. And it's strange that I've gone through all these sort of stages of it as well. There's a lot of information, as there always is, on these wiki pages. Some of it I relate to a lot, some of it I don't. There seems to be a lot more to do with the picking rather than the scratching, although both are valid. There are some psychologists who believe that picking behaviour can be a result of repressed rage felt towards authoritarian parents. A similar theory holds that overbearing parents can cause the behaviour to develop in their children. Potentially contributed to it in a small way, but I think actually the bullying and the trauma at school was more likely to be the main cause. Several references to OCD. Could be inherited. Diagnosis. Like I say, there's loads of information on this. I'm not gonna start. Picking causes a substantial amount of distress and substantially impairs everyday functioning. Now, on a daily basis, other than the damage I'm doing to my skin, sometimes it wakes me up. If I'm scratching so much and I'm fidgeting, that wakes me up. It's also pissed off a lot of my boyfriends. In fact, one of my boyfriends literally once rolled me off the side of the bed. Nice. Yeah, I think like it only really occurs on exposed areas of the skin. So most of the time, a lot of what I wear, I'm quite covered up. It makes it kind of difficult if I want to go to the beach or go swimming, because as soon as I know like my legs are exposed, I'm at risk of compulsively then scratching that area without even being aware of it. So it does increase my anxiety and goes some way to dictating what clothes I'm likely to wear. I don't think that qualifies as impairs everyday function. Mm-hmm. Like I'm functioning, mostly. Yeah, similarities with other conditions. Trichotillomania. Yeah, it is OCD related. There is a much greater share of females with dermatillomania. Interesting. Yeah, compulsion to engage in the negative behaviour despite the knowledge of the harm. Yeah, I know how much damage it's doing. I can see the scars on my legs. And it still continues to happen anyway. Lack of control over the problematic behaviour. Yep. Oh, that's an interesting one. Feeling of pleasure while engaging in the behaviour or feeling of relief. Okay. I was going to say, I wouldn't really classify it as pleasure strictly. But if they're associating that with a feeling of relief, then yeah, it's like anxiety relief or reduced anxiety after engaging in behaviour. Yeah. Interesting. Yeah, it's OCD related. So I've never actually had treatment for this, other than I suppose to treat the symptoms of having the dry, damaged skin, and I've used a lot of bio oil around my, scarred areas. But with it being suggested, with its leaning towards a OCD condition, it does suggest that there's probably therapy-related treatments for this, which is interesting. Only 30% of individuals with this disorder sought treatment. Well, yeah, I am currently in that other 70%. To the point of it's not actually anything that I've even spoken about, really, to anyone. Counselling. Behavioural treatments include habit reversal training, cognitive behavioural therapy. Okay. Yeah, see, I'm not going to say it's like a massive thing for me. I have got far worse conditions that are definitely ruling over me on like a daily basis. I wouldn't say this contributes much to my ability to function on a daily basis, but just say like hindered by shame, embarrassment, and humiliation. May take measures to hide their disorder by not leaving home, wearing long sleeves, wearing trousers even in the heat. Yeah. Yep. Can last anywhere from 5 to 21 years. Well, look, I can tell you now, I've had this for as long as I can remember. I'm now rapidly approaching 34. Many doctors consider this to be a permanent diagnosis. "16% of respondents pick their skin to the point of noticeable tissue damage." Yep. Yeah. That's my my overshare for today. It's my disorder of the day, dermatillomania. I just wonder if anyone else has ever had any experience with this, whether it's scratching or picking or anything else relating to OCD, anything to do with trichotillomania. How long have you had it? When did you notice it? What were the things leading up to it? Was there a situation you can remember? Like, is there something that triggered it? Is it something that happens to you daily now? Does it not affect you so much, but it's still kind of occasional? Is it anxiety related for you? What other coping mechanisms do you have? I've just got coconut oil. That's it. Have you ever had treatment for it? Have you ever tried behavioural therapy? Did anything work? Do you have anything else that you think relates to this? Any other conditions? And I have a feeling, actually, a lot of my conditions are all related to the exact same thing. But that's a different video. All right, that's enough. I'm done. Yeah, let me know your thoughts. Thanks for watching.